But without further ado, let me introduce Dr. David Gordon and Wendy Coates, who are going to be talking to us about good outcomes for great education research.
Thanks, Matt.
Thank you, Matt. Thank you guys for coming, because I know there are a lot of wonderful options to choose from today, so we appreciate you being here. I'm Dave Gordon. I'm the Clerkship Director at Duke University.
And I'm Wendy Coates. I'm a Senior Faculty Education Specialist at Harbor UCLA in Los Angeles.
Neither Wendy or I have any financial disclosures. Being educators, that comes with no surprises. What we'd like to do today, obviously 20 minutes is only so much time to cover a large topic of educational research, but we'd like to use this time to kind of highlight what we think are some of the important components and steps of producing high-value educational research. And things that we'll emphasize in this talk are thinking through different study types and what are meaningful outcomes that are more likely to be accepted for publication and lead to better research. At the same time, we may have different levels of researchers in this room. Some may be very novice, some may be more experienced, or actually more in the mentorship stage. So we're going to use a little bit of a style here where Wendy and I will be role-playing, me being the junior faculty, Wendy being the more experienced mentor, which is very true to real life, trying to display a mentoring model while we're also covering these materials as well. So when we're standing, we're speaking. When we're sitting, we're kind of in our role-playing mode in our characters. Hello.
Hi, Dave. I'm so glad that you could make it today.
Yes, thank you for making time with me. I mentioned that I had this study idea that I wanted to share with you. I'm very excited about.
Yes, yes.
And like you asked, I did a little background research as well. But basically, I know my medical students are not great at differential diagnosis. I mean, they're good, but I think they could be better. And I wanted to think of an innovation that might help them in their differential diagnosis. And I thought, wouldn't it be great if in their sleep they could hear me podcast the differential diagnosis? So like they're sleeping and your patient has chest pain, myocardial infarction, pulmonary embolism, aortic dissection. And over and over and over again, they just hear me podcast. I think this could be great. So I looked at the resources that you asked me to with Google and Eric. And what I found is that differential diagnosis is important. People like podcasting, but I couldn't find anything about nocturnal podcasting. I found the finer construct a little bit helpful. I do think it's feasible. I can do podcasting, absolutely novel, and I think this could be a difference maker. So from that standpoint, I wanted to talk to you about what the next steps might be. This is where I'm at right now. I thought on Sundays I could do chest pain podcasting, and Monday they do abdominal pain. And I'd like to know, how did they feel about it? Did they feel smarter? They probably slept better. And maybe would they pay for it? Because then I could build like a whole podcasting studio. Anyway, that's where I'm at, and excited to share it with you.
Well, Dave, I'm so really impressed that you followed through on our initial conversation when I asked you to consider finding where your study would fit into the background literature and whether your ideas had already been tried and different things like that. And really, podcasting is a very modern and unique method of medical education. And I got to hand it to you, I have never heard of nocturnal podcasts in medical education. I had an interesting question for you, though. Have you ever tried a nocturnal podcast yourself?
Well, sometimes I might listen to it, and it makes me fall asleep.
Okay.
Yeah.
And in the morning, let's say your wife asked you, hey, that podcast that was blaring outside of your earbuds last night, what did you learn from that? What would you tell her?
I don't know how much, but I swear sometimes in the morning, like I felt like I learned more. Like I knew a piece of knowledge in the morning I didn't know before I went to bed. So I'm wondering if it works.
Okay.
I think it might.
Well, I think what we need to do is we need to take your enthusiasm and your great idea, and we need to step back just a moment and really evaluate what we can measure as far as an outcome. You know, have you considered that beyond the people just really liking it and, you know, wanting to listen to more and more podcasts like this?
Yeah, well, liking it would be great to hear. I mean, ultimately, I like them to be better differential diagnosis. I mean, I think that would be the real marker of success.
Oh, yeah, that sounds great. How do you think you could measure that in the emergency department?
Oh, well, I could probably just give him, I was thinking about giving him like some cases and then just seeing what, like written cases and seeing what differential diagnosis they came up with.
Okay. Well, I think what we need to do now is we need to think a little bit about differences in some methods that we could use to find out if the actual process that you're putting them through is really creating a difference. And so I think right now, why don't we start talking a little bit about outcomes and different ways you could design a study so that we can measure some outcomes as opposed to just seeing if someone liked their educational experience.
Okay. Maybe, so tell me, with outcomes, did you have advice on outcomes from your end?
Well, you know, if I'm in the emergency department, and I'm sure that you've been there too since you're just a wonderful clerkship director, and you know what happens is sometimes the students will come up and they'll have like premature closure, and anybody with chest pain will just be someone who has acute myocardial infarction, and they won't even differentiate between a STEMI and an NSTEMI. And well, I think that maybe one of the most amazing outcomes would be that with the differential diagnosis, that let's say the time from presentation in the emergency department until discharge would be greatly reduced if people had the full differential diagnosis. And you know how we joke about this? They wouldn't have to play at a lab every time they talk to the next most senior person. That might be a great outcome.
Wow, that's pretty, I didn't even think at that level.
Yeah. So, and the interesting thing is there's so many different steps along the way that we could measure outcomes. You know, we could measure how much they knew, we could measure, whether their behaviors changed, and then, that would maybe be the final outcome, is to see if there's a real difference in the patient care in our emergency department. And frankly, I just really hate to tell you this, but education research in emergency medicine has really, really passed the point where liking something is going to get published anywhere at all. We can't really assess whether their confidence level is meaningful. And frankly, if you give the podcasts, I don't know if they've learned anything or if it's just that your podcasts are so good that it's a measure of you, not of the test subjects.
Okay. Let me pause here just to show some of the points that we were trying to illustrate. One is dealing with a ridiculous project, but respecting someone's enthusiasm. This was kind of my beginning study objective, which was kind of loosely developed, but you can see I'm rooted in like the enjoyability, the likability of things, and as Wendy was just kind of saying, that doesn't necessarily cut it for where our current standards. We have to go beyond that. And so developing a study objective is kind of crucial to this initial stage. And Wendy, if you want to talk a little bit about, like, when you're mentoring someone to study objective, some of the things you really kind of highlight to them.
So one of the most important things when you do a study, for those of you who are novice researchers, I would say that you get your great idea, and it's probably here, and then you just drop it down to the absolute basic research question, so that you can learn all of the things about the process of your research, how to do your IRB, how to enroll subjects, how to do a background literature search, how to do all of the writing and submission process, and then progress to a more complicated study that has higher level outcomes. But you want whatever outcome that you choose to be measurable and something that could be recreated in multiple settings. So if we have an educational intervention that we design, it could be carried out at your institution or my institution or any of your institutions given the product. And it doesn't have anything to do with the person administering the intervention. It has to do with the quality of the intervention itself. And then we find a way that we can measure it, ideally in the absence of any kind of background noise. Larry Greppen wrote a fantastic paper several years ago that doing education research studies is like chasing rats through a sewer system in a major city, because there's so many different confounding factors when you're dealing with humans and education-related studies. What did they know before? What was their prior experience? What's the patient population that's just going to happen to come in? And so you really have to do your best to control as much as you can, and then, you know, take a chill pill and realize that you're never going to be able to be as perfect as you would be in a controlled laboratory setting. You want to make sure that you can actually test your hypothesis, not just say, well, yeah, I think it's kind of like that, but that you would measure literally like the time the patient arrived and the time the patient left the department. Maybe you take over here while I get a drink of water.
And then the last thing is, you know, we're familiar with Peacoat when we're having our learners kind of dissect articles and define what it was looking at, but it can also be used when you're developing your research question and kind of getting that specificity that Wendy was just talking about. And then we were getting into the Kirkpatrick levels of evidence that some may be familiar with, but the idea that we're beyond the reaction phase, like how did you feel about it? Did it make you feel confident? That your baseline really has to be at the learning, that you are demonstrating some form of knowledge acquisition. Even better, but more challenging, is when you can show change in behavior, like in simulation or the workplace. And then the ultimate, which is hard in education, is actually you're showing changes in outcome, like there is actual change in clinical practice or clinical outcomes in the emergency department. But either ourselves as researchers or those we mentoring, we have to at least get them to the learning step.
The level, yeah, the level two.
Level
at
two.
least, did they learn anything? If you did a Kirkpatrick level 2 study, you might have a chance of getting that published. You know, perhaps if you had multiple institutions or if it was a very important topic. What we would like to aim for are the Kirkpatrick level 3 and 4 studies, and fortunately we have simulation as an option which can mimic a clinical setting, and you can have a lot more incidence of the intervention in a controlled time that would have a measurable outcome that you could you know, determine ahead of time and come up with some critical actions that you could measure. And so that would be a good entry level for a meaningful outcome that changes behavior. And then finally, if you could actually see the results of that in the emergency department or even down the road, like to hospital discharge, or, you know, you could think of any number of different things with that.
So that kind of was meeting one. There was some preparatory work where the researcher is asked to do the background research and their search, and can even come in with the introduction of the article already written. And then phase two, after that meeting, which would be to kind of make sure the study, you know, the project is viable, the study question is good, Wendy would at that point ask me, okay, let's work on to methodology, and encourage me to pick a journal and look, or two, and to look at the author's instructions. And so this is the one for AEM education and training. This is not meant to be read, but this is kind of what you want to direct someone to look for the methodology and see what, like, this article is asking you to provide, so you have that up front. And then, depending on the skill level of the person you're advising or yourself, you could actually at the next meeting come in with the methodology written or well developed and make that the basis of your second meeting. So, so again, here are some of the different study strengths. Again, thinking, is this a Kirkpatrick level 1 or 4? A workplace setting can get you to any of those levels. SIM can get you to 3, and classroom can at least get you to 2. So that's going to be important to think about what level of outcome you can do. And here are some different study types. Is it survey? Is it just a before and after post-test? Is it behavioral change, either workplace or simulation? There are also some mixed method studies in there. So we will go, we have about 4 minutes, so
okay.
we'll go through. So now we're back in the office, and So Wendy, I did like you said, and I looked up some methodology, and I think I want to run through some ideas from you, but I think this one might work well, where I test them, give them my podcasting, and then test them again.
That sounds like a really great place to start. And this is your classic pre and post test design, which is a Kirkpatrick Level 2 study. And this gives us knowledge of what the student knows before your intervention and what they know about the differential diagnosis of chest pain after. I think you can do this quickly and you can do this reliably. And if you really wanted to bump it up one more notch, you could even give them a, several weeks or months later retention test. And the interesting thing about this is, if we're giving them a pre and a post test, we want to avoid the primacy issue of, oh, I recognize that question. That's the one that the answer is communication in a disaster is always the answer for that one. And so what we want to do is we want to generate 2 questions that address a particular, let's just say something silly like which leads have demonstrate inferior wall changes. And that you would want to make 2 questions to address that issue and then randomly assign the pre-test or the post-test after you've validated that the results of that with a appropriate pilot group are equivalent. And then you could just say that, randomly you assign one or the other to a pre and a post test, and then you have a more robust outcome than just saying, oh, I recognize that question and here's the answer on my post test.
Okay.
But I have a few ideas for a little bit more elegant study design for you.
Oh, that'd be great.
Yeah. So the second study design that we could do is we don't want to deprive any student ever of an educational opportunity, and we want to make sure that all of our students are exposed to the same knowledge as part of their course. So in this study design number 2, we give everyone the pre-test. There's a control group and an intervention group. The intervention group gets the podcast, and then they immediately take the post-test. And then they all get the lecture, so that everybody has a lecture on the topic, because that's the standard of the course. And then after the lecture, then the control group would get the post-test. And if you want to bump it up another notch, everybody can get a podcast. Maybe one gets chest pain and one gets like the headache or something. And then you can have, it's not quite a crossover design, but you do expose people both to podcasts and to lectures. And you can see by the structure of this that the post-test comes after their lecture, and we don't expose the same test group to a lecture and a podcast. We measure their outcome just after the podcast. And then finally, we can have, maybe a little bit of a way for us to see whether podcasts themselves are useful by giving everybody a podcast and testing them on both. And this way, everybody gets a podcast, everybody gets lectures, and everybody gets a pre-test and a post-test. So it gives us a little bit more information.
Great. So with the last, 30 seconds. So different study designs, again, developing comparison groups. If you just did the pre and post test and that was all you did, you could randomize by months and get some comparisons there. Otherwise, these are other models to kind of get different comparison groups that have different strengths, also different levels of intensity. Thinking about mostly institutional studies, because that allows you to increase your sample size, you get more generalizability, you reduce kind of selection bias, now you know a little bit more. You're actually testing the quality of the teacher or the quality of the instructional method, and multi-institutional studies can help reduce that. In the handout and up here, these are some ways to tap yourself into resource networks, and our handout has this listed as well. And so just to recap, what we wanted to cover here was the idea of the beginning phase, the background research, pursuing the novelty and the relevance, but also coming to terms with what is the clear objective and what level of evidence do I want to go for, and do I have the right setting to achieve that. And then we covered a little bit of the study designs, looking at different ways to have comparison groups and thinking about multi-institutional to even further strengthen your study.
And you brought up, I think you inserted it here, if you're a mentor of researchers who are very junior, you can weed out the ones who are actually serious about following up with you by sending them back to write the background and introduction of the paper before you're meeting with them about methodology. Because if they're not willing to find out where their study fits, they're probably not going to want to continue and they're going to miss deadlines. Subsequently, after we have our meeting together about the methods, I have them go back and write the methods section, and then the paper's half written. And all this is, working as a mentor and a mentee, both gain from the relationship, and we have, a chance to advance the careers of our junior colleagues and to, do enjoyable new studies, as more senior people. And then the pillars, I think we just wanted to mention kind of at the end, it takes like a lot of good training to be able to do things, and you shouldn't try to do this without proper background and education. You need to have a good mentor or mentors, and you need to reach out and form collaborative networks, and that would be like a strategy for success for all of your education research projects.
All right. Well, we're out of time, but thank you for your attention. Appreciate you coming.
Yeah.